Eating disorders are behavioral conditions in which normal eating behavior becomes disrupted and rewarded in an unhelpful way, much the way alcoholism or other addictions disrupt and interrupt normal function. In the case of eating disorders, whether it's anorexia or bulimia or other eating disorders, patients' normal eating routines become interrupted, and there's either severe weight loss or binging and vomiting or other behaviors that become rewarding, that become habitual, and are difficult to interrupt. We don't know what causes eating disorders. We are sure that there's a genetic contribution. Families with eating disorders tend to have children who are at higher risk for getting eating disorders. But we also know that environment is a factor. The culture of thinness makes dieting more prevalent, makes young women in particular vulnerable to pursuing a thin ideal. Thinking about what causes an eating disorder is difficult because the initial impetus for an eating disorder to develop might be something innocuous, like starting a diet, but might also be something troubling or traumatic that's happened to a person. But those are not the same kinds of things that then sustain the eating disorder. Once a person goes beyond dieting or excessive exercise and the behavioral pattern really develops, that it becomes self-sustaining. So if you think about a boulder at the top of a hill, what pushes the boulder initially might not be the same thing that sustains the boulder crashing down the mountain. And so all kinds of things sustain the behavior. Social isolation makes it harder for people to rejoin their peer group. The physical changes that accompany eating disorders, like a smaller stomach, make it harder to eat larger meals without having a great deal of discomfort. Those kinds of things all sustain the eating disorder. And in part, that's because eating disorders are often used to manage patients' feelings. So feelings of distress caused by anxious social interactions might then cause people to engage more in their eating disorder behavior.
Eating disorders don't occur in isolation, so they often travel with what we call comorbid conditions. Some of these are psychiatric conditions, including especially depression, anxiety, or substance abuse. And in order to effectively treat the eating disorder, you must treat both. So it's very important for treatment to focus not just on the eating disorder, but on the patient as a whole. Another important point is that anorexia in particular is associated with significant and sometimes very serious medical complications that may require the expertise of a variety of medical specialists and not just mental health workers.
It's important to understand that treatment has to be sequenced. First, you change the behaviors, get to a healthy weight, interrupt all of the other behaviors, and then if you've been able to do well, after about 6 months, some of those core ideas and feelings that are central to the eating disorder, like disturbed body image, will begin to ease. But that's the order in which that happens.
The correction of body image lags behind the behavior change. In a sense, it's similar to an addiction where craving takes longer to extinguish. So you will still want to use the substance for quite some time after you stop using, but eventually that craving will fade away. So a way to think about body dissatisfaction in eating disorders is a parallel to craving and substance use.